Question to the Minister for Health, and it relates to the appointment of a child psychologist for the area of North Roscommon, and it's coming from Deputy Eugene Murphy. Deputy Murphy.
And I'm thankful to the Minister to be here to deal with this issue. Minister, the need to fast-track the appointment of a child psychologist for North Roscommon is something that I've been highlighting for the past number of months. Indeed, it is one of the main points I raised with Minister David Staunton during a recent Oireachtas briefing for the members from Roscommon Galway, in light of the 36 Syrian children who will be seeking refuge in Ballydreen in the coming weeks. The immediate appointment is also necessary for the children from County Roscommon who have been left languishing on a never-growing waiting list since last summer. Indeed, I have tabled parliamentary questions on the appointment and had this issue listed for topical issues. And I understand in recent days that the Department of Health has approved the replacement post and a panel is now in place. And I welcome that, and I suppose the pressure did pay off in the end. However, it is extremely important that this vacancy is treated as a priority and filled as soon as possible. Many of the Syrian children coming to Ballydreen will undoubtedly have suffered untold trauma, so it is vital that this post is in place before the refugees arrive in Ballydreen. In the coming weeks, I think the first week of March. 36 children will be included in the group of 82 Syrians. That figure includes 13 children under the age of 4, 19 children in the 5 to 12 age category, and 4 children over the age of 13. There is a child psychologist covering the south of the county, but there is currently no child psychologist covering the remainder of the county, and particularly the north of the county is missing this. I understand that the child psychologist which was covering North Roscommon is on sick leave, and the post has been vacant since last summer or before that. And there's already a lot of Roscommon children on that waiting list and unable to access child psychology services. I'll give you one example of a 6-year-old boy referred by his GP to the psychology service in Roscommon. But after several weeks of phone calls, his parents finally received a call informing them that the psychologist looking after school-aged children was on sick leave since March 2016 and that a locum would not be found or could not be found with the post. Officials could not say when the service would become available, but they indicated that no children had been assessed since March and that the waiting list would be significant. The school decided that they would use the one assessment they are allocated each year to secure services for this child. His school spent several weeks trying to find out when the assessment would take place, only to hear a few days before the Christmas break that they would not be offering any assessments to the school as the psychologist is still on sick leave and no arrangements are being made for the post. The family from the county are not asking for preferential treatment or to skip the queue. They just want to see their son have access to the services that they contribute towards and are supposed to be available in the public health care system. As you know, a number of the Syrian children will also be arriving in the county, as I've said earlier. And many of those children, Minister, as you know, will have suffered a lot of heartache, a lot of brutality, a lot of suffering, and they certainly will need the support of child psychology services. So I'm asking, Minister, that this issue is addressed. I welcome the fact that the panel is there, but we must fill this vacancy as a matter of urgency for the young people of County Roscommon who desperately need this service. And as I stated there earlier in my few words, the list is growing and we need to deal with that. We don't want long lists in situations like this, and child psychology, I'm sure you'll agree, is a very important factor to have there for the youth.
Thank you very much, Minister Corcoran Kennedy.
Thank you, Count Corley. I want to thank Deputy Murphy for raising this important issue here this evening. I'm advised by the Health Service Executive that there is currently a vacancy in the psychology service in Roscommon, as you've referred to, arising from extended sick leave, and that a replacement post has been approved. I understand that there is a basic grade psychology panel in place and that the vacancy is being treated as a priority and will be filled as soon as possible, taking account of the recruitment process. Primary care services are usually the first point of contact for families who seek help. With appropriate information and training, GPs are best placed to recognise risk factors for mental health issues, to provide treatment or advice where appropriate, and to refer to more appropriate services or specialist services when this is indicated. Issues of a mild to moderate degree benefit from intervention at primary care level. Many children and adolescents experience mild emotional difficulties, which are often transient and do not require specialist intervention, but require support from other services. The HSE's National Service Plan provides €5 million to address psychology services in primary care. This allocation aims to support services to work more effectively through increased resources and the development of new ways of working, both within primary care and between primary care and mental health services. Primary care and mental health divisions in the Health Service Executive prepared joint plans for a more integrated primary care-based psychology service to focus on providing better access and using a multidisciplinary and multi-method approach. The approach would address existing deficits and target those areas of greatest need. From the funding, the HSE proposes to fund over 100 assistant psychologist posts to deliver rapid access, low-intensity psychological interventions for young people with mild to moderate mental health problems, and this is currently being considered by the Department of Health. In addition, 20 additional staff-grade psychologists for children in geographical areas where there are none or inadequate numbers of posts in place are currently being recruited. The dedicated funding will also provide for the delivery of a computerised cognitive behaviour therapy programme for young people. The additional posts will provide services to service users under 18 years of age to address those waiting for treatment in the mental health and primary care divisions, while the online resource will also be developed for adolescents with mild to moderate mental health presentations. Resources are allocated to work towards ensuring that there is a consistent baseline in terms of staffing across primary care services, with the greatest areas of need being addressed in the first instance. Working in partnership with other service provision stakeholders, primary care psychology services will adopt a stepped care model of service provision in child and adolescent services. These services will include rapid assessments for all referrals, a single point of contact to the healthcare system for all non-crisis and non-complex emotional or behavioural referrals, and a continuum of care through integrated working with primary care and secondary care professionals and with community agencies. Service provision will be monitored and evaluated regularly to ensure these resources are providing this new model of step care provision for young people. The Deputy may rest assured that the Department of Health, in conjunction with the Health Service Executive, will continue to closely monitor planned service improvements for this key care area.
Thank you, Minister. Deputy
Orla, and I acknowledge the Minister's response, and I know her heart's in the right place, and I know she takes her brief seriously. But there was two PQs put down in relation to one of these cases, and I'll just give you the reply to one of them. The case was referred to the Primary Care Child and Family Service in May of 2016. The psychologist for this area is on long-term leave, and we wait national HSE approval for the temporary backfill of this post. Unfortunately, until such time as this position is filled, there are insufficient resources within psychology to cross-cover for this vacancy. In other words, a shortage of money. I trust that it's information of assistance to you. And also the second reply was to one of these cases. The psychologist for this area is on long-term leave, and the PCMG has approved this backfill. We are currently awaiting national HSE approval. So the reality is, in the case of one of those families who went to a private psychologist and paid significant money and got their assessment and were told that the 6-year-old needs support because he is suffering from autism, there's nothing there at the moment from a Roscommon perspective. Now, there will be some time available in the school, I think, come September, but the Centre of Excellence in Athenry, which deals with autism cases there, I'm told, has a 2-year waiting list. So we have significant problems, Minister, within the system, and I'm sure you acknowledge that. And I don't want to see particularly, 5, 6, 7-year-olds left in a situation where they can't be assessed, or even if they are assessed, where they can't get the treatment for a long period of time. So you know my case, you know where you're coming from, and I'm asking you to give it your best shot and ensure that that child psychologist is appointed to Roscommon, because we certainly need it there at the moment. Thank you.
Deputy Murphy. Minister, to conclude.
Thank you. Well, Deputy Murphy, I know you'll be glad that the replacement post has finally been approved by the HSE and that the replacement is being treated as a matter of priority, and the intention, as I'm told by the HSE, is to fill that post as soon as possible. And you know, I know you'll understand that I can't comment on your specific examples, but it is helpful to raise them. Just, I suppose, to be helpful in relation to what you mentioned earlier around the new visitors coming to Ballahondreen, the Irish Refugee Protection Programme was established by the Government in September 2015, and the intention, of course, is to provide a safe haven for persons seeking international protection. A programme office has been established by the Department of Justice and Equality, which will oversee that programme and support the work of the task force. One of the objectives of the structures is to ensure that there is a coordinated approach in addressing healthcare and support needs of the people arriving under that programme, and a number of health-related initiatives are already in place to support refugees. In this context, the Health Service Executive is working to assess the overall care needs of the group that are due to arrive in Ballahondreen, both at local level and with TUSLA, and expect to put appropriate measures in place to address those needs. And attention to the provision of counselling and related psychological support services will form part of that approach, and the Department will be kept informed on all of the progress as it happens.
Very good.